Welcome back to Real Talk with Just for Girlfriends. This is a special episode dedicated specifically to the COVID-19 vaccine. We went live in January when the vaccine was initially being launched. So if you need some background information on how the vaccine was created or what's in it or what the concerns were then, search the videos on Black Doctor's Facebook page. In fact, search for just for the number 4 girlfriends. You'll find all of our past shows. But today we have a full packed hour. So we're going to introduce ourselves and then we're going to jump right into it. Hi, if you have not seen the show before, my name is Michelle Skinner. I am a member of Just for Girlfriends and have been for over 3 years now. I am on the board of directors and I also manage Just for Girlfriends social media accounts. And you'll see our handle scrolling across the bottom of the screen. Please follow us on social media. We have discussions like this and so much more happening there. Robin, please introduce yourself.
I am Robin McFarland, part of the board of directors as well for Just for Girlfriends. It's very first member. And just a career woman like everybody else here, but looking forward to hearing about boosters today. So I'm super excited.
Angelique.
Yes. Good evening, everyone. My name is Angelique David. I am the founder and CEO of Just for Girlfriends. For those who are not familiar with us, Just for Girlfriends was built on the mission that women are always so busy doing everything for everyone that we often forget to take care of ourselves. So Just for Girlfriends brings a unique experiences to women to help embrace self-care and self-preservation. We have 2 live, and yes, you heard me, those who watch our show, we only had 1 live last month. We have 2 live locations. We're operating out of the DMV area and the Chicago area. So if you are interested in joining our amazing sisterhood, please go to justforgirlfriends.com below. So I am excited about this show. So much has gone on about vaccinations, and we're here to make sure that we give everyone some really good information.
Absolutely. So without further ado, we are so pleased to have with us 3 very special guests. We'll bring them in now. Oh my God, welcome ladies. We are so happy that you're here. I'd first like to introduce Catherine Moran. She is one of our J4G sisters. We're very happy that she can spend the next hour with us discussing the mandatory vaccines and what that may mean for you and where you work. She's the principal of Jackson Lewis here in Chicago, and she often speaks on employment law matters and writes on those and shares some articles on that as well. So you can find her if you're looking for employment law counsel. Next, I'd like to introduce Dr. Francine Pierce. She specializes in pediatrics here in Tinley Park, which is a suburb of Chicago, at Specialty Physicians of Illinois. Thank you, Dr. Pierce, for joining us. And last, but certainly not least, we have Dr. Gigi. She, you may remember her from a show that has also appeared on blackdoctor.org called House Call. Dr. Gigi is certified in internal medicine and is currently an academic general internist at George Washington University in Washington, D.C. Dr. Gigi, welcome.
Thank you.
Well, as everybody knows, we've been in this pandemic, seems like forever, but at least since 2020. And it seems like there are just as many questions now about the virus and how to protect yourself as it was, back then. So we're so happy that you are here with us to sort of shed some light or provide a little clarity around some current issues that are being discussed. The first area we like to discuss is mandatory vaccines in the workplace. And I believe, Angelique, you're going to handle that for us, right?
Yes. And so Catherine is one of, so in my day job, I work for a company, and Catherine is one of my outside counsels. So I will give the caveat that Catherine, in her time here on our show, that she is not creating an attorney-client relationship. Her advice cannot be relied upon. As she is your counsel, you have to call and get a special engagement for that. So I wanted to make sure I gave you that cover, Catherine.
Thank you for that, Angelique.
The first question that seems to come up with every employee because we've heard all over the news, it's mandatory to be vaccinated. You have to be mandatory. The first question that always comes up is it legal? Can your workforce actually say that you have to be vaccinated to work there?
Well, pretty much the answer is yes, Angelique, with a lot of big caveats. Like everything else in law, it's not a sure thing, except in Montana. For those of you in Montana, they cannot require you to be vaccinated. Some other states are trying to pass laws, but so far that's the only one that's actually done it. But barring that you're in Montana, no, it is legal. And we've seen it. At the beginning, employers were reluctant to mandate the vaccine, but that's been changing over time. More and more are doing it, and now the federal government has kind of come out behind it.
So kind of following up on what you just said, earlier this month, I know that President Biden ordered a sweeping new federal vaccine requirements under the OSHA guidelines. What does that vaccine mandate mean for employers?
Well, we wish we knew. Actually, there are a number of different mandates. OSHA has a standard for healthcare employers who are kind of in a special category, and I'm sure the doctors know healthcare has required other vaccines, and they have a very good case for requiring vaccines. But for other employers, the president came out and he said, we're going to have a requirement for federal contractors and for federal employees. And just on Friday, we got the very complicated rules for that. But that's not the majority of employers. The one that we're all talking about is President Biden said, we're going to have a mandate for every employer with 100 or more employees. And, I can't tell you how many clients have called saying, okay, well, what does that entail? Well, we're waiting for OSHA to tell us literally what it entails. They're supposed to put out regulations in October, but they're going to allow what they call a comment period where, everyone who's on this call can write it and say, no, I don't think they should do it that way, or it should be something different. So we don't really know exactly what it's going to entail, but I will tell you that many of our clients in that space, the 100+ employees, have already done their own vaccine mandates before the president's announcement.
So, Catherine, I have a question. When you mentioned a comment period, that seems like that is going to further complicate the issue. Is that how new guidelines are generally announced with the comment period?
No, not necessarily. And I'm not sure why they're doing it with this, except for the fact that it's so controversial. There are some types of federal regulations where they do that. I think perhaps they've done it because there's a lot of controversy over some of the things OSHA has said. For instance, they've come out and said you have to pay employees when they're off for COVID, and there's controversy about whether OSHA even has the power. OSHA is the federal agency that regulates workplace safety, whether they even have the power to, tell you to pay somebody. But the EEOC came out very early on and said, employers can mandate vaccines. So the EEOC is behind this. They don't see it as a problem.
So so let's say you just said lots of your clients have mandatory vaccine policies. What happens if an employee refuses to get vaccinated?
Well, mandatory vaccination policies are not as mandatory as you might think, because you have to allow accommodations for sincerely held religious beliefs under Title VII. You have to allow accommodations under the Americans with Disabilities Act for persons with disabilities. And so that's a huge caveat. So you can't just say everyone vaccinated or you're off with your head, because you've really got to allow for those accommodations. And that's really what's causing the headaches for the employers. Some employers have decided, because the vaccine is unpopular and because there's so much resistance, to do a policy where you either are vaccinated or you have to get tested every week. So that's another option. But when I say accommodation, for instance, if someone has a sincerely held religious belief against vaccination, you could allow them to work from home. Or if that's not appropriate, you could require them to test and wear a mask and sit in a private office or something like that.
Okay.
But remember, I just want to add that there are mandatory vaccines to go to school, right?
Right.
So it's not like there isn't some other, it's a little bit different for a workplace. And of course, Catherine, as the legal person here, of course there are differences, but in college, when people go to college, they're required to have vaccines. You mentioned healthcare workforce. We're required to have vaccines, hepatitis B. Children certainly are. I know that this is different than the workforce, but at the same time, I feel that some of these arguments are somewhat, well, they're politicized, right? And they are in a way artificial, right? In my view.
Right.
Absolutely. This is
I
not.
see, yeah, Lisa Jones, one of the people viewing us, she said the same thing. There's precedent for requiring vaccines. So you guys are, yeah, that's spot on.
That's right. George Washington required the troops to get the smallpox vaccine. So
Yeah.
kind of goes way back.
Right.
Was that before or after they gave the smallpox infected blankets to the indigenous people
Oh
and
my
wiped
God.
them
I
out?
don't know.
Yes. just want to
Probably
be
after.
That's horrible.
historically, complete.
That's going to go down a whole nother rabbit hole.
I know.
We
That's true,
won't
yeah.
go down that rabbit hole.
No.
So, Catherine, one last question before I want to make sure that we have time for everyone. So, what are the risks of mandating that your employees become vaccinated before they return to work, or if they can come to work? Are there risks for a company, and how would they mitigate those risks?
Well, the risk is the same risk with a lot of things that are new and untested, is that you might get litigation. The worst kind of litigation, of course, for a company would be if it was a class action and a class of people who don't want to be vaccinated sue. And for instance, there are some ways to mitigate that, such as not advertising when you post jobs that you're requiring vaccination. There are a lot of people out there putting out, form letters that you can write to your employer. So there are people who are probably thinking, well, this will be a way that I can go and make a bunch of applications and then, bring charges under Title VII to the EEOC saying they didn't accommodate my religion or they didn't accommodate my disability. So I think employers need to be mindful of really considering the accommodation requests and handling them in a professional manner. The thing that's different about this this time around with mandatory vaccination, they're getting a lot more requests, and there's frankly seem to be a lot more that don't seem all that sincere, but it's hard to get behind that.
Yeah. And does the vaccine not being FDA approved at the time have any bearance on, if people can or cannot take it, or should?
Well, actually, yeah, that was a really big, at the beginning, that's one of the reasons that most employers were not mandating the vaccine. And there was concern about that. There was some litigation around that it was under the EUA, the emergency authorization, and could you mandate something that's not even really approved? That litigation was kind of shot down, and so people began to fear that less. Then the vaccines were approved.
Yeah.
Yes, Robin, that's a really good point, because that was one of the reasons in the early days employers were reluctant to mandate. And I think also we've had a lot more experience now with the vaccine. Saying you have to do it on day one would have been a lot scarier.
Right. Yeah. One thing that I think with President Biden's orders and EEOC and thing that you're really I think the government is trying to help employers, because everyone at first hesitated. They didn't want to be the one to put out the mandatory vaccine policy. And this really gave everyone cover. So it kind of goes back to, well, where are you really going to work?
Right.
And I know we hate to stop and think about that, but if everybody does it, then you're stuck with working possibly with a company less than 100 people. And that's a pretty small company, probably not the same pay, probably not the same size of everything. And then I think and we'll see where this goes, but as you start seeing restaurants, sporting goods, et cetera, unfortunately, I really think that the unvaccinated unvaccinated or untested in the last 48 hours, let's just call it that, because there are all these exceptions, will really be prohibited from dining, seeing concerts, movies, et cetera. So it really is trying to move the whole country in the right direction.
Yeah.
Oh, I'm sorry.
we're hoping when the rules come out that it will give employers some cover. You know, because if the government is telling you have to do it, you shouldn't be able to be sued for that.
Right.
Yeah.
One interesting point is that, we have OSHA regulations and all kind of things to make the workplace safe. And when those things fail or people get injured at work, whether it's inhaling a toxic gas or some sort of injury that occurs because the building was unsafe, everybody is up in arms that there was no regulation or overseer to ensure our safety at our workplace. And honestly, it's the culture that we're living in why there's so much pushback, because it's kind of like we're arguing to be arguing. Because at the end of the day, we have a pandemic going on. We have a huge infectious disease that especially healthcare workers are likely to get if you are dealing with patients with COVID. So why wouldn't the government intervene is the larger question. And so if we just kind of step back and kind of look at the trees for the trees, I think we answer a lot of our own questions, because I think some people are just in it to fight. But all these regulations for our safety are already in place.
That's true. Yeah, it's a
And
hot topic for sure. Yeah.
Yeah, and the analogy that I like to use is the safety when you're boarding a plane, right? Because there are rules and regulations of getting on a plane for our collective safety. And sometimes what you hear in the arguments is like, well, only 3% of people die from COVID, so why should the government interfere? Well, if 3% of the people getting on a plane died every time the plane went up, what would we be saying? That's the government's responsibility, right? The government is there to assure our public health. It's for the public good. So I think that that's so important, a point, Dr. Pierce.
Yeah.
Right.
There's a question in the audience from Janice Forte. She wants to know if you could lose your job if you refuse to get vaccinated.
I'm going to take that one. Yes, there are, most employers are trying to be cautious. They're trying to work with employees, but there are employers that are taking a hard line, and some of them feel that it's just an undue hardship not to have everyone vaccinated, maybe because their workers are so close together and they've had lots of COVID outbreaks. So there are employers that are firing employees. I believe United Airlines put, the workers who didn't get vaccinated on an unpaid leave. I think they're characterizing it as being fired. So yes, it's possible.
Yeah.
You're on mute, Michelle.
I am so sorry about that. But absolutely. I was saying, I think now is a good time to transition into our next topic, which is vaccinating children 12 and over. And Dr. Pierce, you're the pediatrician in the group. So please, I'm going to direct these questions to you initially, but anyone who has something to comment, I would welcome your comments.
Wonderful.
So first off, when we talk about vaccinating kids, are kids at as great a risk of catching COVID as adults?
So the answer to that is no. By far, they have less risk. Probably of all the COVID cases, only 14% are for pediatrics. But one thing, even before starting to talk about vaccines, I think it's super important that we acknowledge it, particularly in the world of pediatrics, why parents are so fearful or have greater concerns. We always have greater concerns for our children than ourselves. Mm-hmm. So if you're part of my family out in the Tinley Park area, one thing about my practice is that I view my role as an educator. So I want you to bring your fears to me. It is my job to use my knowledge as a scientist to explain to you why those fears are legitimate or not, so that we're not functioning out of fear, but we're actually functioning out of fact. So when families come in and, if I haven't had this question a million times in the last 12 months, I would be a millionaire if I got a penny for every one that I've answered. But children, thankfully, are doing well with COVID. even despite the news reports that children are being hospitalized at higher rates, even the fact that we see in many states that the ICU beds are full, overall, children do well with COVID. The scary part is that we're seeing rising rates of children not only contracting the disease and being symptomatic, but rising rates of children being hospitalized. So we have to really kind of, as medical professionals, look at that and extrapolate that forward. If this trend continues, then this will start being a pediatric disease, and this will be a whole different conversation.
Yeah.
That's a very good point. Being proactive.
And on top of that, I have 2 kids. I don't care what the small percentage is. I don't want to be that one. I don't want my kid to be that particular one who is hospitalized or has a fatality because of COVID.
Absolutely. And I had a child that just turned 12. He received his second shot on Friday, but he wanted to get it, after living through this pandemic and worrying. And he was like, I'm 12. I want to get it. So, of course, I'm
Well,
like,
you brought up an interesting point, because here in DC, we have a law that allows children to proceed with a vaccine without parental consent. And this was more of an issue for HPV vaccines, but they're also doing it for the COVID vaccine.
Right.
But I just wanted to add in terms of children and COVID, because true that the percentage of people getting COVID, percent-wise, it hasn't changed. But because Delta is so much more contagious, the absolute numbers are going up. And although death rates, thank God, are not common among kids, the number one group that is dying of that small group are Black and Latino boys. And we're not sure why it's boys versus girls. So, and I would add this, if we want to protect our children, we have to get vaccinated. Because we're the source of the virus to them. And obviously, Dr. Pierce, as the pediatrician, can talk more about, child to child transmission. But we, the adults, are the ones that can protect our kids. We're the bad guys in this case.
absolutely.
Right.
Yeah.
It certainly is an ongoing cycle, because, people say, well, if kids aren't getting very sick, why put them at any risk to vaccinate them? And the answer to that is that if you leave them unvaccinated, then the virus does have the opportunity to mutate, and then its virulence and its resistance to the vaccine will increase. And therefore, it'll be a continued cycle that now they will get sicker and more, and our vaccines will not work. So, it's so important. It's kind of like when you're talking to your kid about life, and you say just spectrum and what the effects could be if left unmanaged.
You brought up
Very good point.
You said something that I want to follow up on, because you said people say, well, what about the risks? Let me ask you, are there any safety concerns with the vaccine? Are there risks with taking the vaccine for children?
Sure. There are risks with taking anything. So with Tylenol, if you look at the side effects that are listed on Tylenol, absolutely, there are risks. And there are risks because your body could have an allergic reaction to anything. It could be the safest thing in the world, but if your body has a reaction to it, certainly there are risks. Now, I will say the risks are small. When they have done all of the studies, one of the benefits we have with using with the COVID vaccine is that no other vaccine has ever been able to been rolled out and been given to the hundreds of million people across the world of all races, size, colors, and everything else at once and get data back. So when people are like, well, I just don't know what it will do and we need more time, guess what? We have more data than we've ever had. So, and in the control studies that have been done, the response has actually been very good. One of the bigger ones that I think people are talking about is the myocarditis and the pericarditis, which is an infection and inflammation around the heart. It's still an extremely small percentage of people who would be at risk. Less than 1% would be at risk for getting that in the pediatric age group. And still, of those children, I think I even wrote the numbers down. Of everyone, it was 300 people actually met the CDC guidelines, and that was of all age groups. And of that, no one had prolonged illness or death associated with it.
Wow. Okay.
One of the important things to recognize is that you are 16 times greater to have myocarditis if you get the COVID illness itself. And you are likely to have long-term effects and be hospitalized and be much sicker with that. So
That
it's
is a
important
great
to
point.
balance the vaccine side effects versus the COVID illness effects when you're weighing out your risk and benefits.
Dr. Pierce, I know right now that they say, children 12 years and older can get the vaccine. Will there be a time when kids younger than 12 will be offered the vaccine?
Absolutely. Right now, Moderna has studies going from 6 months all the way to 11, and Pfizer as well. Pfizer has a greater study in the 5-year-old and up. So actually for 5 and up will likely be coming out soon. Within the next several months, we should see the vaccine down to that age group. And, they always ask, like why 12? Why did we stop it at 12? It was initially stopped at 16, and as you get younger, it's harder to get people into studies. So therefore, there are many things in pediatrics we don't have full studies on as far as what can be used in the age group. Sometimes we have to extrapolate the findings and say, would this be safe in children or would it not? But because you can't get the large numbers of infants being, assigned to studies, that makes it a longer process to get these approved in the pediatric.
I was just, I'm on the advisory board, community advisory board for children's, and they just presented some information which I thought was really interesting. So when they opened up the clinical trials for children, a lot of the doctors signed up their children.
Mm-hmm.
I thought was very telling. There are actually a lot of people that wanted to get their kids in the clinical trials, which I think should say something about safety to the general public. If a lot of physicians have confidence, right, that obviously we wouldn't put our kids at risk. But I thought that was, because that's not usual that people jump to get into a clinical trial.
Yeah.
Well, another interesting thing I find is I have families that come in and, they'll say that they didn't get the vaccine because they're following this doctor online, and the doctor said absolutely not to get it. And I'm always a little taken aback by that, because I'm like, wow, because you entrusted me with your children's health. And you know me. So we have to be mindful of, who gets airtime on the internet. And a lot of those can be paid sources by people who are either politically driven or have other reasons for promoting negativity against the vaccine. One of the things, though, that I encourage my families to do is not just to look at what's happening in the United States, but actually look at what's happening worldwide. Countries such as Switzerland, Australia, Japan, their public health policies are very, very strict. And if they are utilizing the same vaccine that we have here and they are promoting it there, that speaks volumes as to the safety of these vaccines. So you don't have to just focus on here. You can do a search for articles on what's happening in these other countries, and then get a pulse for what the world is, how the world is responding to the vaccines.
Right. On our first show back in January, I think at that point the vaccine had just come out. And at that point, I think all three of us, Michelle, Robin, and I, who we've all been vaccinated, but all three of us were kind of like, I don't know, should I? But ultimately, the one thing I said then, and the one thing that really triggered me to get the vaccine is, I know of, many people know of people who have died of COVID. I don't know anyone who's died of the vaccine. And so I needed to take death off the table. I'm a mom, I'm a wife. I needed to make sure that I'm here to raise my little ones. And I never would want anyone to have to say, or for them to even have to think, had my mom just gotten vaccinated, she would be here.
Right.
So I think it's just so important to take death off the table and ask around, are there people who you know who've died of the vaccine?
So I think we have to be careful when we talk about death from the vaccine, because if we understand how death from a vaccine gets reported, for instance, if you get the vaccine and you decide when you go home 2-3 days later, you're going to commit suicide, that is a death that will be attributed to the vaccine. If you go outside and get hit by a car, that is a death that will be attributed to the vaccine. So death occurring within a certain period of time from being administered gets attributed. So it's an important, the CDC reports exactly what the cause of death was. So most of the information that people question is actually available to us to understand. So people have had adverse reactions. I think Johnson publicly had talked about the clotting disorder and the people who died from there. But when you think of the number of people who have died from it versus the number of people who are vaccinated, that's where it's kind of, I use the example with my families of, if you sat your child in the middle of the highway, you would be more worried about lightning striking them than the cars coming at them. So it's important to understand that there's clear and present danger from the COVID vaccine that exists around us constantly. And that no matter your age, no matter your race, no matter what, you could die unexpectedly of COVID. And we see the stories over and over again.
Yeah.
So we have to stop functioning out of fear and understand that we are in a pandemic, and who dies from it is very difficult to determine.
Yeah.
So when we are, as parents, are considering vaccinating our children, are there certain children, if whether they have pre-existing conditions or not, that should avoid the vaccine because of the higher risk of and reaction to it?
No. If you have, so the ingredients of the vaccines are very simple. You know, there's basically sugar, salt, and lipids in the vaccine. But if for any reason, like if you've had a reaction to anything that is listed in there, then those are the only people that the American Academy of Pediatrics recommends should avoid it. Anybody else, honestly, like peanut allergies and all of that kind of stuff, there's no peanut, there's no egg, there's nothing like that in there. So they can get the vaccines.
Oh, that's good.
That's great.
And I should know this, but I don't. Are there other vaccines that are required for children 12 years and older?
Yes, the HPV vaccine we give anytime after the age of 11, pretty much. The second Menactra, which is or actually both Menactras are due after the age of 11, so that's the meningitis. The meningitis B vaccine, which you see more commercials about that, but it's not a mandatory vaccine. That is also recommended. And so any and all of those can be given at the time that you're given the COVID vaccine.
Okay, then that's what I was going to ask.
Yeah.
Okay, so there's no counter interaction.
There was some discussion that HPV and COVID should not be given at the same day, a month apart. They've come back and withdrawn that, but I think you'll see most health practitioners giving some pause between those. So they usually do try to separate it.
Okay.
One last question, unless someone else on the panel has one, but what I've heard just from hearing other parents talk, they say that, 12 years old is so arbitrary. Is there a reason why the cutoff right now is at 12 years or older?
It's not so much arbitrary as it is it's how many people they could probably get in a study. I haven't seen any exact specification as to quote unquote why 12, but I assume that as they get younger and younger people into the study and they get sufficient numbers, that's how the age is determined. So now they're targeting getting all those 5 through 11s in, but that's a much harder group to get in the study. So
okay, well, great. Oh my gosh, that is great information.
Well, thank
If
you.
anyone out there is watching, parents that are considering getting their children vaccinated, hopefully we've answered your questions. If there are others, keep them in the chat. But
Yes.
I'll turn it over to Robin.
Before you turn it over, may I add just one other thing
yes.
that I think is just really important for families to remember is that the children who are at greatest risk are the ones that are obese, have severe asthma, not just occasional, but severe asthma, or any underlying severe autoimmune disorder. So it's important that we recognize that if those are the people who are at risk of dying from this, you really should. I know that, they're like, oh, but they have this. Should I get the vaccine? Absolutely, you should get the vaccine because their risk of dying from this disease is much greater. And again, our African American little boys are at probably the highest risk, but people of color represent 75% of the children who have died from.
Wow. Wow. That's high. Horrible high. Can you repeat those pre-existing conditions again? I think that's important for people to know.
Severe asthma and autoimmune diseases. And I said one other. What did I forgot now?
Obesity.
Obesity. How can I forget obesity? Yes,
Right.
obesity.
Okay.
And
Sickle
that's
cell
another
and sickle
one
cell
issue
disease.
in children. Yes. So,
And sickle cell, right?
Sickle cell also. Yeah. Yeah. Okay. Thank you, Dr. Pierce. That was
you're welcome. Thank you.
very good information. Okay, Robin, I'll turn it over to you for our third and last topic.
Sure. And I'll be directing these questions at Dr. Gigi, but anybody else can, follow up and respond as we are thinking about boosters. I know I'm just about 6 months into my vaccine. And so, I'm thinking about a booster but I don't know if I qualify. So last month, Biden administration and Dr. Fauci announced that they wanted adults to get the vaccine booster shot. What prompted this?
So what prompted it is that we were seeing breakthrough infections in the people who are at high risk. And we'll talk about that. Before I talk about that, though, let's talk about your body's response to a vaccine, right? So what the vaccine does is you get an injection and it's teaching your body how to protect itself. Think of it like the Mission Impossible tape where they give you the instructions and then it evaporates. That's what happens, and the body is learning to make antibodies. We know that when you're older, above 65, when you have other chronic medical conditions, if you have all the conditions that Dr. Pierce just mentioned, being obese, having diabetes, having asthma, being treated for cancer, that your ability to mount the highest antibody response is muted, right? So let's say that to be protected from getting COVID, you have to have an antibody response that's this high. Well, what happens is that, older people or any of the people that are at risk may get their antibody to this, but guess what happens? Over time, it starts to decrease. And at some point, that threshold gets crossed where they're no longer protected. Let me give you another example. When you're 65, you get the high dose flu vaccine because you need to have more of the vaccine so you can mount a higher antibody response. So what we're seeing, I just took care of a patient. He's actually young and otherwise healthy. Young, he's almost 50. He works, he's not a physician, but he works in the hospital, and he had gotten 2 doses of Pfizer. The second one was in January, and he was hospitalized with a breakthrough infection. He did fine. He was in the hospital for about a week, but that's what prompted the changes in recommendations. So who should get them? And then again, just like the disclaimer was announced at the very beginning, you've got to check with your clinician and make sure that this makes sense for you. But people who are in frontline jobs, not just healthcare people, but if you have a lot of interactions with the public, you're driving the bus, you are, a custodian in a school, you, of course, a clinician, any sort of outwardly facing job, your chances of being exposed to COVID And not only that, the amount of virus that you're exposed to is higher than if you're working from home, right? So those people that are really outwardly facing, what we call the frontline workers, but people think that that means just doctors and nurses, but really it's a pretty big group, as well as the people who are at high risk, really should get, I wouldn't even think of it as a booster. I would think of it as their third dose,
Okay.
because that's the way that they will be fully protected. So let's give another vaccine example. So hepatitis B, when it first came out, it was 2 doses. And then we realized that, oh, you know what? That's really not enough, that the vaccine antibody starts to wane. So they added a 3rd dose. So I think we should think about it in that way. That way it's not so confusing. But, obviously the science has to lead us. And, the current vaccine, thank God, seems to protect against the Delta variant. And that's why, what Dr. Pierce has mentioned earlier about the importance of getting people vaccinated so there's less of a chance for the virus to mutate and morph is so key, because you know what? Maybe the next variant is not going to be covered by the vaccine.
Yeah.
And, one of my friends, Dr. Melissa Clark, used this analogy, which I think is so helps me. And that is, when somebody's infected with COVID, their body turns into a COVID manufacturing plant. They are turning out so much virus. And then that's when, in the movies where somebody is shooting against like a monster, and the more you shoot at it, the more awful and deadly it becomes. So the more that it's replicating, because people are not protecting themselves, the danger goes up to all of us, not just the unvaccinated, but the vaccinated. I hope that answered your question.
Yeah, that answers several of my questions here.
Dr. Gigi, someone asked in the chat, does having MS qualify them for a booster?
Yes, it would. Now, they have to talk to their doctor, okay? And I actually looked this up because I wanted to make sure that the booster or the vaccine itself, because I've gotten that question, would not harm somebody with multiple sclerosis. And the literature has shown that there is no harm, but they fall into a category that they may not have mounted the best antibody response. But I'm not giving medical advice. The person asking the question should check with her or his clinician.
Okay. Is there harm in getting a booster if a person doesn't need one or doesn't seem to need one?
Good question. I guess it depends on the timing. We don't really have data on that, but I will say probably not. And that's based on our previous experience with other boosters. Somebody just came into clinic today and had gotten a pneumonia vaccine last year and got the same one again this year. But we don't know for sure. That's a good question.
If we extrapolate, like in pediatrics, if you lose your vaccine record, we have to kind of revaccinate you. So using that as a basis, likely not. So.
Oh wow. Okay, revaccinate you. All right.
I didn't know that either. Right.
I didn't know that either. So, and if you talked about the Delta, but I know there's other variants. I know I've seen Lambda out there. So, does the booster and the shots vaccination we're getting currently, is it protecting us from those additional variants?
We don't know quite yet. It seems to. I mean, so far those have been small numbers. But again, this is why not just vaccinating, but masking and washing the hands and physically distancing for people that are vaccinated and the ones that are not is so important. The way that we're going to get through this pandemic is for all of us to work together and to see, they've done actually studies on countries that have actually adopted the vaccinations and follow the recommendations on the government has. And it really has to do with how they feel about belonging in their country. So I think we have a problem. If we don't feel like we, belong, or we're alienated for whatever reason, or things are so polarized, we've got a problem.
Yeah.
Yeah.
Well,
And that
I think we have such a history, and everybody, defers to this history of um, the African American community being used inappropriately in the study of medicine. So there's just valid fear of large rollouts of programs that many African Americans and minorities in this country fear. But it's important. That's why I say you have to do a little bit more research and see what is going on around the world. Because if you look around the world, you will see people of every nationality and race are taking this and doing well. And if we are not taking it, then we will be at greater risk of dying of the disease, which we're already seeing. And since we do suffer from those pre-existing conditions such as diabetes and obesity and those kind of things, then unfortunately our fear is going to lead us to die more from this disease. So,
Yeah.
Yeah.
So, Dr. Gigi, you said one thing that kind of resonated with me because my husband says this. So he's ex-military, and if anyone knows, in the military, you go through a line and they give you all kind of shots, and you do that for your country. You do that for your people. You do that to make sure that you are protecting everyone. And so his opinion has been consistently, we do this for our country. We do this because we have to get through this together. He also often will also say, you see people taking other type of risk, whether it's recreational drugs or whatever it might be, even unprotected sex, and yet we won't do something like this for our country. So I think it's as you said, all in it together.
Yes. Well, and then there are other things that, our society requires. Seatbelts, right? You can say, well, it's my personal choice. Well, actually, it's not, because that could impact somebody else. Or drunk driving. You can't drive and drink. But I wanted to speak to the point that Dr. Pierce made, because I actually established the Rodham Institute, which is dedicated to improving health equity in DC. And we're members of the Black Coalition Against COVID. And I would really encourage people to visit that website, blackcoalitionagainstcovid.org, because we worked with the descendants of the Tuskegee experiment. So they actually have an incredible ad campaign. And actually, I had the honor of seeing 6 of them whose fathers had syphilis and were not treated. There's a lot of misconception about what the Tuskegee syphilis study was. Sometimes people think that people were injected. They were not injected. They just were prevented. They were not given the treatment that was known. And so it was very, I think, important to hear the stories of these men. Tuskegee is relatively small. And so these, there were the grandkids, the nephews, nieces, cousins of the people of these men. And they came out very much in support of getting vaccinated. And one of the things that I think is important to understand, look and see who is involved in making the vaccines. We know about Dr. Kizzy Corbett, who was instrumental, if not the person that developed the Moderna vaccine. And actually, as a result of what happened in Tuskegee, there are these review boards that require scientists to make sure that there are not abuses. Does that mean that there are abuses in our medical system? Absolutely. And I would say it's more in the clinical, because look at one of my people from my medical school, Dr. Susan Moore, who graduated from University of Michigan in 2003. She documented how she was treated when she had COVID. She said, I can't breathe, I'm in pain, and she wasn't given treatment, and she died. So it's not just the historical legacy, it's the ongoing legacy about how Black and Brown people get treated. But in this particular area of clinical trials, because of these historical abuses, I think that there has been oversight. And I would really encourage people to go and see these videos and learn about it, because there's a lot of disinformation, misinformation that's out there. So that's another resource in addition to blackdoctor.org.
And where can we find the videos again?
Black Coalition Against COVID or you can just Google the Legacy Project, or just say,
That's
you
wonderful.
know, Tuskegee Descendants. I think it'll come up that way.
Okay.
Dr.
Yeah,
Gigi,
it's very powerful, very powerful.
there's another question from the audience. Someone wants to know if they have just recovered from COVID, can they be vaccinated right away?
It depends if they got monoclonal antibodies or not.
Mm.
So if they did not get monoclonal antibodies, we wait about, between 2 and 4 weeks. Monoclonal antibodies, we wait for 3 months. And I just want to say something, because this is a huge area of disparity. We find that monoclonal antibodies, when somebody has COVID, is not being offered to Black and brown people at the same rate as it is being offered to their white counterparts. And one of the big ironies to me about the vaccine is that people are refusing the vaccine, but they'll take the monoclonal antibody treatment, which is actually much more complicated and complex than the vaccine. So it's kind of interesting there to me.
Well, that's usually because they're pretty sick by the time they need it, so they just want relief.
Yeah.
That's true, but if you look at what some people are saying, that's true. But some people will say, I'm not going to get the vaccine because if I get sick, I'll just get the monoclonal antibody. I guess I meant it in that context.
Yeah,
you're right. When you're sick, of course, you're going to
you'll
do whatever
take
it
anything
takes.
at that point.
Yeah.
But there are people who are actually, I've always got this as a backup.
Yeah.
It's interesting.
Yeah, that's not good.
I'll ask one more question here. What have doctors learned about the COVID-19 virus since the pandemic started?
Well, I'm 62. I did my residency during the AIDS epidemic. And if you think about it, that virus is so complex that to this day, 40 years later, we do not have a vaccine. So we are lucky, as horrible as this pandemic has been, that we have such a simple virus. It's really very simple as a virus. It's like nothing. That we were able to get a vaccine developed so quickly. And this is, I think, this story that has not been told, which is a good story, is look at when the scientific, the research, the public health, and the physician or medical community works together, because that includes nurses, of course, together across the world, how quickly that vaccine came about. The technology is not new. That technology is 10 years old, but putting everybody's heads together for collective good. I think that sadly, the lessons are the same. When I was an intern and I was actually a medical student, I was being taught about AIDS. We were told it affected the 4-H club: heroin users, hemophiliacs, homosexuals, and Haitians. So just like you saw with the previous administration, what did they say? Well, it's people with pre-existing conditions, as though that doesn't, that you have chosen to have a pre-existing condition. People who are older, and the third group that they didn't mention is Black and brown people, right? So there are some things that we actually have, it's the same story over and over again. I think for some people, not us, because we always understood health equity and the structural and social determinants of health, it kind of uncovered for them, unveiled the deep, deep disparities. But yet again, we're seeing it's a same, song, different day. I could use a different analogy, but it would not be proper for me to use that language on this show. But yeah, I think we have learned some things, and yet we're still making the same old mistakes.
Right. And I'll just add to that, and that's why it's so important for me to really function more, not to, give this, finger shaking lecture when people come into my office, but really offer sound advice and a clarification to the information that is out there. And I allow them to tell me all of what is inhibiting them and their fears for getting the vaccine, and answering those. Because, I've heard from extremely crazy and silly to very legitimate reasons, and they all need to be addressed. And they need to know that we're hearing them and that we understand why in this time people are fearful of the vaccine. So,
Well, I mean, and that's true of anything, right? Any medication, any treatment. I
Right.
mean, you know, I had one patient who was afraid of getting insulin because his brother died of diabetes, and as soon as he started taking insulin is when he got sick. So he associates those two things together. So it's legitimate if the person believes it. And I agree, it does not help to just say, do it because I said so.
right. And many
That might
people
work
will
if you're a
say,
parent, though.
right. Many people will say, well, I'm not going to take, the measles vaccine because I know one person who, their child had became autistic afterwards. The research completely disproves autism being related to the measles, mumps, and rubella. And then we ignore how many millions of children have been saved from getting the vaccine. So, because one person that had an ill effect, if you look worldwide and you see that lives have been saved, we really have to try to understand the importance of these vaccines.
I think we have one other good question on the board. If someone has recovered from COVID, do they need to get vaccinated still? We talked about how
Yes.
soon after, but do they?
Mhm.
Yes, they do, because they remember we talked about the antibody being at a particular threshold. They may not have enough of a threshold or coverage. I've actually taken care of people who've had COVID twice because they had the COVID and then they recovered and then they got it again. They were not vaccinated.
Right.
So the answer is
And that's why
absolutely yes.
You can get it.
And
again.
I just want to mention one thing, because I think we look at COVID as death or life, but there is another group. I saw a lady today, she cannot think. She just is having a lot of difficulty focusing. We've also seen people's blood pressure go up after COVID. We've seen people have constant chest pain, shortness of breath, fatigue. So it's, I mean, so if I'm going to die, I'm going to die. Well, there are things actually, in my estimation, that may be worse than death, like
Right.
disability or dependence or any of these other things.
Right.
Yeah, I would echo that. We have the three of us have a mutual friend who's just an amazing woman, young woman, prior COVID, and is a long hauler. And so I've seen her have to wear a heart monitor to figure out why her heart is racing, or just have constant worries and complaints. And she's a year post COVID and still dealing with symptoms. So it definitely is something you don't want to get or have these long hauler effects.
And it's important to recognize in children that we are seeing greater numbers of children with long hauler syndrome. So again, it is changing from when the virus first came out, and these kids did very well with it. That is truly those numbers are shifting. So.
Well, thank you, ladies. My goodness, there was a lot of information here. We really appreciate your time. Our hour is up. But I would encourage you to visit the chat after this is over. So continue to put your questions in the chat. We will visit them and answer what we can. But I mean, this was a special episode of Real Talk. We thought it was necessary and timely to get this information out to you. So we appreciate you watching and your time. Real Talk with Just for Girlfriends will be back at its regularly scheduled time, which will be the first Tuesday in October 5th at 3 p.m. Central. And this time we're discussing how you can grow old gracefully. And we're not talking about this physically, you know what I mean? So please.
Sign me up for that one.
We'll have some nuggets for you on that one as well. But again, we're going to put our website and our social media handles across the bottom of the screen. Please visit us on the web. You can sign up for our newsletter, see what we have going on. Hang out with us on social media. We have all kind of fun things going on over there as well. So again, thank you for your time and your attention, and share this with someone who you think could use this information. Please share.
And thank you to our guests for joining us today.
Yes, thank you.
Absolutely.
Thank you so much.
Thank you so much for having me.
We'll see you guys next week.
Thank
All
you.
right, good night.
Bye.
Good night, everyone.
Bye-bye.
Bye.